Let's go on into our next story. We'll be talking about public health as regards sexual and reproductive health of the people. We have usually these issues where a lot of people have complaints as to their sexual health and reproductive health, how healthy they are when it comes to that. But the quintuplets born on April the 12th at the National Hospital in Abuja are said to be doing really well.
And that shows some people are really healthy, really. They have 5 at once. Doctors in care of the babies say they are in good health and will be certified ready to go home soon.
Okay, we have a public health consultant here, Dr. Perpetua Mbanefo. It's good to have you join us right now.
Good morning. It's my pleasure to
Right.
be here.
If we make comparison how reproductive health has been before maybe the past 2 decades and now, we've heard some experts have said that reproductive health, the health is not as sound as it used to be, as in the quality is dropping. Is that, can you confirm to that?
Well, I wouldn't say the quality is dropping. However, what we see these days is that more people are becoming more successful at reproduction than before because of the technologies, especially with assisted fertilization and conception. I will say the success rates now are greater than before. But of course, with the lifestyle of this day, people's lifestyles these days is different, unlike before. So of course, that will affect their reproduction. Okay, based on what they eat, their inactivity levels, and of course the alcohol and the drug use.
Okay, so your diet can affect your fertility?
Yes,
yes.
Your diet can affect your fertility. There's been some factors that have been found to affect the possibility of you having multiple pregnancies.
Okay.
And amongst that is your lifestyle, which really is the diet. Okay, people that eat more of whole milk have been found to have higher chances.
Whole meal. Let's talk in Nigerian parlance. What does that mean? Whole meal. What kind of food? What variety of food falls within that?
No, I mean
category?
whole milk.
Milk. Oh, okay.
Yes,
okay.
and people that eat low dense, low fatty foods have been found to have lower chances than people that eat high dense foods, and then the whole milk increases the chances as well. Of course, this is not hard and fast. If you have a family history of multiple pregnancy, that increases your chances. If the maternal age is within the 30s and the 40s, of course, that increases your chances as well. And of course, some other factors like the number of babies you've had increases your chances. For this particular case, I can't say exactly whether it's a natural conception or assisted. It's quite...
from the report we heard, I think she said it's a natural conception, no fertility drugs.
Yeah, that can happen though, that can happen. Even with the family income and all of that, that can still happen. However, the challenges are now the problems that face multiple pregnancies, especially when it comes with, as they develop, they might be healthy now, but further as they develop, they compete for attention from the parents.
The children now.
Yes,
okay.
the children. Apart from the disabilities that might come later, okay, some cerebral palsies have been found to be more common as the number of the twins or the babies increases. And of course, they compete for their parental attention and some other issues as time goes on. And of course, let's not forget financial difficulties. Raising 5 kids is raising
at the same time.
Yes,
That's a lot.
It's a lot of challenge.
Raising one sometimes can be very challenging.
It's a lot of
so what can be done to be able to enhance and maintain reproductive health as the case may be? Because relying on technology, it should be natural. When you rely on technology, doesn't it paint a picture of shortcomings?
Well, there are some cases of natural conception. However, when couples are having difficulties conceiving after 1 year of unprotected regular sexual intercourse, we say there's a problem, they are infertile. You're advised to see your specialist. I work with a fertility specialist. You're advised to come for reviews. We'll do some series of tests to find out why. If the lady is ovulating, if she's not, if the man, you check the sperm count or seminal fluid analysis.
Thank you. You took the word out of my mouth, because fertility doesn't just reside with the women.
No,
Men
it doesn't.
too can be sterile sometimes.
Of course, they
so
can.
how do you handle that of a man?
Okay, at first we advise them to come as a couple, not just the lady. So when they come together to the clinic, they're advised and counseled. Of course, you do the seminal fluid analysis. Whatever the analysis is, you counsel them accordingly.
Okay,
all right.
Dr. Perpetua Mbanefo, thank you for talking to us right now.
You're welcome.
Thank you.